Next, we're going to go to behavioral health with Telecare Corporation in San Diego, and Tim Graves, who is the Director of Special Projects and Enterprise Architecture, is going to share with us a bit. Hello, Tim.
Hey.
How are you doing?
Good evening.
Thank you so much for joining us. So, going to go through the same questions with you. If you could tell us a little bit about the program and particularly the scope, what kind of assistance are you providing?
Yeah, absolutely. You know, Telecare is a large behavioral health provider. We operate over 150 different programs. And so far, only one of our programs is a mobile crisis response program. So we're now another tool in the toolkit for emergency services in the county of San Diego. We provide services across the entire county of San Diego, you know, roughly 3.3 million people. To kind of put it in perspective, that's about 2 Manhattans. We operate with about 90 FTE. Our mobile crisis response teams fit a common pattern that you're seeing in a lot of other metropolitan areas. So it's a team that's dispatched into the community and provide crisis intervention services in lieu of law enforcement or EMS.
So how does this work? How do they decide, how do people get in touch with your mobile crisis response teams?
Yeah, there are 2 channels that people can gain access to the services we provide. The first is through San Diego's Access and Crisis Line. This is a crisis hotline. So we'll get referrals from them, as well as directly from the local law enforcement jurisdiction's emergency communication center. So a law enforcement dispatcher can call us directly if they're speaking with someone that's called either 911, or if an officer runs across a client that is in need of crisis intervention services, they can then request that additional resource and they'll contact us.
And so they contact you, have a centralized call center?
Yeah, so we have a virtual call center that we've stood up in San Diego. It's staffed by a blend of dispatchers as well as licensed clinicians. So what we do, they'll either, forward the reporting party to our call center, and we'll begin our triage process. Additionally, what we provide is if it's suitable, if the nature of the call is suitable, we'll actually provide kind of telehealth services using a licensed clinician to help provide some over the phone intervention services where possible.
So when you determine to send somebody out, the dispatcher, gets the information and then does triage, as you mentioned. When you decide to dispatch a mobile crisis response team, how does that work? Are you sending individuals? Are you sending teams?
We're sending teams. They're actually pre-positioned throughout the jurisdiction to minimize response times. We currently operate 7 units. It varies a little bit depending upon the load. To kind of paint a picture for you, the team's comprised of a licensed clinician, a case manager, and a peer support specialist, kind of with lived experience with either mental health, substance use, or other behavioral health challenges in life. So the team will get dispatched from our call center. We use the beacon service to coordinate that dispatch, in addition to other technologies like we operate a FirstNet push-to-talk network that enables kind of real-time communication between our units and our comm center. Sometimes even our dispatchers, like in the early morning, will be working virtually from their home because our virtual call center enables us to have kind of remote workers as well.
Fascinating. So they get dispatched through the Beacon platform, and then you also supplement that with this FirstNet push to talk. Why did you choose the push to talk phones over radios?
So, you know, the cost of a radio can be prohibitively expensive. You know, I have a background in fire and EMS, and you know, my radio cost about $10,000. And if you were to outfit, you know, 90 employees, or you know, roughly a quarter of that's what you have on staff at any given time, it's a significant investment. Additionally, you have to kind of bring your jurisdictions on with you, right? So we serve the entire county of San Diego. They have a vast network of radios and a variety of protocols to deal with that. Additionally, our providers are, you know, behavioral health providers. They're not necessarily trained in the proper use of a radio. And really, I mean, to paint a picture, from the point we sort of received the contract from San Diego to the point we stood it up was roughly about 4 months. And it wasn't a lot of time to, you know, make a capital purchase of radios and coordinate with the county radio authority to, you know, stand that up. So it's really that combination of kind of real-time push to talk FirstNet phones with the information that we can convey in Beacon that really kind of paints a picture for the responders, so that they know what kind, you know, the nature of the environment they're walking into.
Yeah, I think that this is really fascinating for a lot of people, because we talk to a lot of groups, and they sometimes are understandably under the impression that if they're plugging into the local 911 call center, that 911 is going to give them the same radios that they give to police, fire, and EMS. Mm-hmm. And that's, as you're explaining, certainly not the case. So that's really helpful to understand. So when they get on scene, what types of help or assistance are they providing to people who need it?
Yeah, absolutely. You know, the number one priority is, you know, ensuring the safety of the client and the scene. And that was really a little bit of a shift. You know, working in EMS, working in fire, you know, we're taught from a very early stage in our training that, you know, managing the scene is critically important. And it was a bit of an epiphany when we were kind of doing our training with our staff, when we said, look, you're now part of the first response team, right? Like, you're integrated into this system at this point. We're no longer sort of like a behavioral health provider that sort of provides niche services in, you know, let's say for people living in the community. You're really part of this larger system of care that exists. And that was, I mean, everybody's eyes, you know, kind of open really wide when they realize that they're now first responders.
I believe it. How have you been received by the traditional responders, fire, police, EMS?
This was actually something that we invested a lot in really early on, in making sure that law enforcement, fire, and EMS were at the table with us as we were developing our crisis response plan for San Diego County. You know, our program came through the Department of Behavioral Health, which kind of reports up to that larger system of care. But we wanted to make sure that they had a voice in sort of, you know, how we interacted, and made sure that we invested in that relationship up front so that we could coordinate response appropriately.
And so I'm assuming, I mean, myself as a former San Diego County paramedic, this program seems to me long overdue. I take it that they're very happy to have you as a part of their system now?
Yeah, absolutely. In fact, we've already expanded the program once, and I think we're looking to expand it again, as well as expanding into other counties, other states.
That's fantastic. So if you could share a little bit more about what type of volume, how many incidents are you responding to on average per month, we'll say?
Yeah, I don't have the per month number. I do know that since the program opened, we've responded to approximately 1,000 crisis response. We respond in lieu of law enforcement, provided that the environment's safe and we don't need law enforcement to secure the scene for us. We prefer to actually kind of operate independently because it makes space for a more meaningful engagement with a client.
Absolutely. So how does it end in terms of when do your responders know that the call has come to a conclusion? What is the objective they're going for?
Yeah, it varies. There's a couple of outcomes. The most important outcome is that we, prevent adverse events from occurring by simply showing up, or by being there instead of law enforcement. All of our providers are trained in CPI. All of our clinicians, licensed clinicians, have a license, so they've gone through rigorous training in de-escalation and things like that. In terms of outcomes, sometimes we might link the clients to other levels, lower levels of care. So we might link them to, one of our other programs that we have down there, which provides wraparound services for people with severe mental illness. Perhaps, they need some additional crisis intervention, in which case we'll transport them to a crisis walk-in clinic. There are a number of crisis walk-in clinics in San Diego, so we'll actually do the transport ourselves. In some cases, they're a danger to self and danger to others. So in California, we have a 5150, and our licensed clinicians will effect a 5150 hold on them so that we can compel them to get to someone that can provide additional care.
Fascinating. Thank you so much, Tim. Really appreciate it, and just hats off on the fantastic work you're doing.
Yeah, thank you.